All right, A&P1 students, in this video we're going to talk about the effects that aging has on our skeletal system. So one thing that you should be aware of is that our osteoblasts, those are the ones that are producing our bone, the osteoid. And remember, that's the organic part, like the collagen fibers. As we get older, they slow down their production. So they don't produce, collagen as much as they used to when we were younger. So we do have a decrease in that collagen. And remember, collagen provides the flexibility to our bone, allows our bones to kind of flex a little bit, in regard to normal everyday stresses. But they become a little bit less flexible as we get older. And so we're more likely to suffer a fracture, from a fall that maybe wouldn't have caused a fracture when we were younger. So our skeleton will be because of that reason, we call it, they become more brittle, and so more likely to fracture. So that's one effect of aging on our skeletal system, our bones. The other one is that our minerals, so like our calcium and phosphates and things like that, we lose some of that. And so our bones will become thinner. So like the compact bone will become thinner and they'll be weaker. We'll get a little bit of loss of our spongy bone too. Now, this is something that happens with everybody as they age. So it's usually 35 years of age is when we reach the peak amount of bone mass that we'll ever have in our life. But then after that age, the osteoclast kind of start being a little bit more active than the osteoblast, and so we will lose bone as we age. So we will lose those minerals, and our bones will become thinner and weaker. So that's pretty normal expectation, with our bones. So we want to try to, as we get older, not do certain things that we used to do, just to kind of avoid injuries to our skeletal system. So everybody will kind of experience that. There's certain bones, though, that are more likely to cause problems, to age and have the effects of aging. So the vertebrae are ones. The jaw bones, so like the maxilla and the mandible, and then the ends of long bones, the epiphyses, they seem to, of all the bones, lose more mass than other bones. So not to say not all bones can, but those seem to be the ones that lose more than normal. So now the osteoporosis, which we did the case study on, that was like more accelerated loss of bone mass. And obviously there's, different risk factors for that, but that was a process. It can happen in men or women, more likely women, but that's a process where you get, an accelerated amount of bone loss where you, get it a lot more quickly and a lot more, a lot greater decrease in your bone mass. So osteopenia is what they call that, but that's just, going to happen if you live long enough, you're going to have those changes with your bone. But osteoporosis is a condition where you get a much faster destruction in your bone tissue. So, all right. So for the next part of the video, we're going to talk about bone healing, like fracture repair. And so we're going to go to our next page here, and we're going to zoom in on this. So how we break down the steps in bone healing is kind of similar to the steps we talked about when we talked about the healing of the integumentary system. So some of the steps might seem a little bit similar. So what we have when we fracture a bone and it needs to heal, realize and recall that most of our bones are very vascular, meaning they have numerous amounts of blood vessels. So when we do fracture a bone, we are lacerating or cutting those blood vessels too, and so they'll start to bleed, and so we'll get a bunch of blood that collects between the bone pieces, and eventually, since that blood is out of the blood vessel, it'll start to clot, and then we'll form this blood clot. Since this blood clot is forming at a fracture, they call it a fracture blood clot, but the proper term for blood clot is hematoma. So this is the first step. After you fracture a bone, you're going to get bleeding and a fracture hematoma that is going to form. And that's not a bad thing. As long as, we don't have excessive bleeding, that's good to get blood in that area, because that blood's bringing all the nutrients and building blocks, so we can repair this tissue. And, and it'll bring also white blood cells that could protect the body from like an infection, since we have an injury here. So it's as long as it's not excessive, we don't lose too much blood, that's a good thing to have a fracture hematoma there, and it kind of seals off this area. So, all right. So after that happens, then the bone is going to actually kind of do what it have the cartilage come in first, just like we had the cartilage when we were forming bone, when we were still in the uterus. So there's going to be chondroblasts that are going to come in here, and so this kind of whitish material here is the cartilage that's forming between the two fracture ends. And so it's made of cartilage, so they call it fibrocartilaginous. And then it's sort of providing this little connection between the two bone pieces. So they call it a callus. And so they call it a fibrocartilaginous callus, or it's kind of a soft callus. Since it's not made of bone, they'll call it a soft callus too. So those little chondroblasts started to lay down the cartilage in this area, and forms this kind of weak but still connection between these two fragment ends. And you'll also notice that the blood vessels that were damaged, they're starting to grow by mitosis, starting to grow into the cartilage too. So they're regrowing as well, and also bringing needed supplies, nutrients, and building blocks from the blood into this area too, which is good. So then after this forms, the fibrocartilaginous callus, or the soft callus, then that cartilage will start being converted into bone tissue. So we'll have the osteoblasts come and convert that cartilage into the spongy bone tissue that you can see here. So here's all of our spongy bone, and now that it's made of bone, it's been converted to bone, then they'll call this a hard callus or a bony callus. So we got the bony callus in this third step. Now, hopefully, if you look at that, there's a little bit too much bone on this side and that side. So that's not the way our bone looked originally. But it is nice that it's doing this, because it's providing aligning those two fragment ends together and connecting them, so that healing can continue to happen in this area. But it's not, again, what it's supposed to look like, and we want to get the bone back to what its original shape and structure was, so that it can work properly. So after the bony hard callus forms, then what we'll have is the bone remodeling. So remember, that's where the osteoclasts are going to be resorbing bone, or breaking it down or destroying it, and then the osteoblasts are going to be working to lay down osteoid and build that bone up, form the bone. So they will be working, on the endosteum side and also the periosteal side, and then convert that spongy bone to compact bone, and get rid of some of that bone that was in the medullary cavity at that point. So get it back to what it's supposed to be at this point. So what it originally was. All right, so that is how our the 4 steps and how our bones will heal from a fracture. So you need to be familiar with those steps and what order they happen in and why they happen. All right. All right, next we're going to finish up the video talking about different types of bone fractures. And your book does have this long list, but I don't have you know every one of these. So the ones that I would want you to know, we'll go down here, is comminuted. So you should know that that is a bone that has been splintered into several small pieces. So you get multiple pieces with that type of fracture. And then a compound fracture is another one that you need to know. They sometimes will call it an open fracture, but that's where when the bone breaks, the end of the bone punctures or protrudes through the skin. So they call that a compound or an open fracture. Now, if you have a fracture where you don't see the bone, it's not pushing through the skin, they call that a simple, which is down here, simple or a closed fracture, where it doesn't break through the skin. All right, and then our next type of fractures that we want to learn is a linear fracture. So the linear fracture, that's one that's parallel to the long axis of the bone. So that's one where it runs parallel. So let's do this one. So you have to know linear fracture and transverse fracture. So a transverse fracture, it's at right angles to the long axis of the bone. So here's the long axis of the bone, and then the fracture is going across it. So it's perpendicular across there. So they call it transverse. Remember, transverse is also horizontal. So then when we look at a linear fracture, that would be a fracture, which I don't think we have a picture of, but that would be a fracture that would go more vertical or up and down along the length of the bone. So this looks more like a vertical fracture because it's kind of a fracture along this plane up and down. So they call that a linear fracture, and then they have transverse fractures. All right, so let me go back to our objectives here. So we talked about simple, compound, displaced, non-displaced, transverse, linear, and comminuted. So those are the ones that you need to know when it comes to the characteristics or different types of fractures that are on there. Okay, I will see you guys in the next chapter.